we just have a quick, just a few facts about lung cancer that you all can look over. It is the deadliest cancer, claiming over 160,000 lives a year. Unfortunately, there's no early detection test for lung cancer, and it receives the least funding. You can see some more information about it as well. So we're going to start with just some panel questions about advocacy. We may not get to all 4 of these, but we'll just kind of start by going through some of them and, you know, kind of get people's thoughts. And again, anytime maybe you have a question you want us to discuss or any comments, please go ahead and type them into your questions bar in your control panel, and we'll try to get to them. So let's start with that first question there. Why do you think it's important to advocate for those with lung cancer? Randy, do you want to start us off?
Sure. I would say, you know, the number one thing is to be able to share your experience. Those of us who have been down this road, it's when you hear those words for the first time, you have lung cancer, it's life-changing. And for those of us that come in contact with others with the disease, we know exactly how they feel. So it's kind of, we've walked the walk, and we can help somebody walk through that minefield. Everybody's disease is different. Their treatment is probably different in a lot of ways. Their outcomes can be different, but the emotional aspect of it is pretty much the same. And again, I feel it's incredibly important as somebody that has been through the network and down this trail, to share whatever experience I had, so that it might positively affect somebody else's treatment procedure and survival.
Jose?
You know, in my opinion, lung cancer is probably one of the most misunderstood and underfunded, of course, diseases there are. Like Randy said, it is life-changing. So anytime that we have the opportunity to educate people about how and who people affected by lung cancer are, I think it's critical. I think it's going to ultimately affect the funding and the care and the misunderstandings about lung cancer. And all of those things are critical to survival. So if the cancer is funded, we know that there's a correlation between funding and survivalship. So it's really important that we educate folks so that we can advocate for more funding, again, better care, and address some of the stigma issues that we face when you're living with lung cancer.
And Jose, I think you kind of brought up one of our second question there, which is the common misconceptions. What do you see as the common misconceptions with the lung cancer diagnosis?
Well, I think, unfortunately, something that is pretty commonly experienced by most of us living with lung cancer is the association with the stigma of smoking. And that is something that it's one of the first questions that we're mostly asked, when we tell someone that we're living with lung cancer, and it carries terrible stigma, and it really affects the funding. It affects the care that we receive. And we are, you know, it also carries for the former smokers. It carries a lot of shame, and shame is not a good feeling to live with. So whether you're going to live or die, you know, having the ability to live with a disease without shame, I think it's critical in survival. And that is not a luxury afforded to lung cancer patients, whether they smoked or not.
Katie, are you with us now?
I am. Can you hear me?
Yes, we can hear you. Did you want to kind of come in with that, how longevity advocates to change those misconceptions?
I absolutely would love to. First off, in terms of the importance of advocacy, Jose and Randy had some incredible answers, and they are the experts. As far as the disease itself, because it's so underfunded, there's no early detection test for lung cancer. It receives the less funding. 1 in 14 people will be diagnosed. It's important to advocate so that people understand those real facts and that anyone with lungs can get lung cancer. But from a patient perspective, it's so empowering to advocate, not only for yourself, but for other people. And you feel like you have a voice in a sometimes uncontrollable situation. And also, in terms of advocating, that's when you can dispel some of those common misconceptions. And those misconceptions about lung cancer perhaps being a smoker's disease or a preventable disease. There's a false misconception out there that if you don't smoke or if you've quit smoking years ago, that you're safe from lung cancer and it can't touch you. And that's just not a fact. Anybody with lungs can get lung cancer. Smokers who've quit smoking decades ago get lung cancer, and people who smoke never get lung cancer. So the fact is, we really need to dispel those misconceptions so that we can have early detection tests, we can have funding for treatments, and we can have more survivors like Randy and Jose.
And Randy, how did you decide, to become an advocate and really start trying to maybe change these misconceptions and getting the word out there?
As both Katie and Jose have referenced, you can't tell somebody you have lung cancer either in the medical profession or the everyday person on the street and not have them say, "Did you smoke?" It's amazing. And the longer that I have been surviving this and come in contact with people and share that story, I almost get to the point where I answer the question before they even ask it, because it's so ridiculous. And again, as Jose, the stigma there is it's insane, and it makes as much sense as if somebody walked up to you and said, "You have ovarian cancer." If they have ovarian cancer, you would ask, "Oh, well, did you have a lot of babies?" Or if you got bladder cancer, "Oh, did you go to the bathroom a lot?" I mean, it makes that much sense to somebody that has lung cancer, but it's perceived as a disease that we give ourselves, and it's so erroneous, and it's underfunded because of it. And I hate to say it, but smoking is killing people that have lung cancer because of the stigma, not because they're smoking. 85% of the people that smoke will never get lung cancer. And I'm not advocating that you should run out and smoke by any stretch, but that association is it's insane.
And Jose, how long have you been kind of involved in the advocacy work, if you want to talk a little bit about your history?
I was actually diagnosed in 2011. So I am I've had a year and a half into my diagnosis. I was diagnosed with stage 2B and had the opportunity I was very fortunate in which it was caught early, so I had the opportunity to have surgery and had the tumor removed. So my introduction into advocacy was really through LUNGevity and the great work that they do. I also happen to work in public health. I'm a public health spokesperson. So I've been working on cancer issues now for a while, but never from a personal level. So my kind of professional and personal lives have come together, but it was really through the great work that LUNGevity does at the national level that I became introduced to the opportunity to advocate.
Katie, do you want to talk a little bit about some of the advocacy efforts of LUNGevity? Maybe we can just talk about the organization a little bit more.
I can. LUNGevity has been around since 2000, and the main goal of LUNGevity for many years has been funding lung cancer research. So LUNGevity is now the largest lung cancer nonprofit, and it's also the largest private funder of lung cancer research. So research is very important. We focus on early detection, and we focus on targeted therapies. And we also have the largest grassroots network of lung cancer survivors, patients, family members, and medical professionals. And so we feel that offering support resources, offering media opportunities, offering webinars, educational opportunities, ask the experts that we offer online are all ways that aid in survivorship. And we're doing everything that we can to get us a step closer to ending lung cancer. We also have our LUNGevity Hope Summit, which happens in May, and that's where I was able to meet Randy and meet Jose in person. And it's a great survivorship conference. It's a great empowering opportunity, a great opportunity for survivors to meet other survivors, because in the lung cancer space, the statistics on lung cancer survivorship are not as high as other cancers. So we really feel that building a great community for research and for support is extremely important.
Randy, I'm wondering if you could give us, or the people on the webinar, some advice for patients and survivors and family members about how they can, become advocates, start raising awareness. How do you think they should start?
Well, to start off with, to echo what Katie just said, I can't, and Jose, I can't say enough great things about LUNGevity. I was really fortunate to find them, and I did find them through another connection who introduced me to them. I wasn't aware that they existed, but through one of my medical contacts, they told me about LUNGevity, and then Jose and I had the opportunity, the extreme opportunity from my end, to be part of the Hope Summit, which was in May, as she said. And that was an amazing, I can't, there's no other word to describe it, but there were about 60 lung cancer patients in the room. And I hadn't been with that many at any one time. And again, to be able to walk up to somebody who knows exactly what you've gone through, and you know what they've gone through and what they deal with on a day-to-day basis, without having to ask stupid questions or even have a conversation. You just knew, and that was amazing. And again, I just think from an advocacy standpoint, you can't be as involved enough in helping to share this story. And LUNGevity, I've been involved with a couple of the other advocacy groups around the country. Each one has their own set of objectives, and I think they're all doing great things. But for me, LUNGevity, from a patient's perspective, offers the most support. I think they've got an amazing online support mechanism. Katie does. I can't say, none of us can say enough good things about Katie. And the thing that was great from the Hope Summit is we all got on Facebook, and she has her own, we have our own Hope Summit Facebook site. And whenever anybody's going through a trial or is going in for their scans or experiencing difficulty with their disease, we're all there to support. And it's amazing the amount of support that comes just through texting on Facebook. And so again, all those things are fabulous from where I sit.
Well, I guess that brings us, to sort of the support aspect of this webinar and the importance of not just advocacy, but the support level. And I know LUNGevity, does a lot of that kind of work. So, Katie, if you want to talk a little bit about that aspect of LUNGevity, and then we can get into some questions. I know that you have some support networks set up.
Absolutely. This is my favorite stuff to talk about, so
great.
You'll have to shut me up.
And I do want to remind everyone, if you have anything we're not getting to or any questions, please go ahead and type them into your questions bar just to let everyone know. Okay, go ahead, Katie.
Okay. So like I said, LUNGevity offers the largest online network of support for all people affected by lung cancer. We have our lung cancer support community. It's an online, dedicated social network for people affected by lung cancer. It's a message board. 24/7, you can go in there, post, connect with folks, and get information and notice of advocacy opportunities. We have our LUNGevity Lifeline. It is support partners. We match survivors with patients and caregivers to other caregivers, which we call co-survivors. And what happens here is not everybody is online. So you can give us a call and you can request a support partner, and we can match you with somebody else with a similar diagnosis as yours to offer one-on-one support. We also have the Caregiver Resource Center. Again, it's an online, and you can find all these things at www.lungevity.org. And our Caregiver Resource Center is something for the caregiver. Oftentimes, the caregiver is the unsung hero, and it's a challenging position. I was a caregiver for my father who passed away from lung cancer. There's no training manual, there's no how-to manual, there's no pamphlet or booklet that tells you how to take care of somebody with lung cancer and how to deal with all of those day-to-day responsibilities. Our Caregiver Resource Center has that. And then we have wonderful stories of hope. We have a great blog. We feature lung cancer survivors like Randy, like Jose, that offer information. We have a very active Facebook page, facebook.com/LUNGevity. We have over 12,000 folks on there, and they offer each other support and information daily. So like I said, if you've been affected by lung cancer, we encourage you to go to lungevity.org and give us a visit.
And Randy and Jose, Randy, if you want to start, and then we can get to Jose. I'm wondering, what was your biggest source of support when you were first diagnosed with lung cancer? Because you said you didn't find LUNGevity right away.
No, I mean, my biggest support was my immediate circle, my closest friends. Again, when I first got diagnosed, I was diagnosed in 2008. So I'm inching up on the 5-year mark, and in case you're not aware, that's a major milestone with this disease, because I think it's less than 15% survive 5 years, which again is just, as Jose was alluding to early on, is just incredible. But my greatest area for support was my oncologist, of course, and then my immediate family and my extended family, if you will, of very close friends. It's really what I relied upon. And they were all great. And you need to know, I mean, when you're in this situation, I know a lot of people are afraid to ask for help or support, but I was overcome by the amount of support and giving that people proffered up. So it's there, and I know that you can get it. But yeah, it took me a while. I mean, I knew nothing about the disease, so I knew nothing about cancer. Period. I didn't even know that advocacy groups existed. So this was all new education for me across the board.
And Jose?
I want to be Randy 3.5 years from now, by the way. That's great, Randy. Got a long way to go, but, with lung cancer, you really live, at least for me, I live, at the beginning you live from scan to scan. So it's not just like at the beginning of your diagnosis, you go through a tough period. I mean, everybody that's going through scans, you go through tough periods. So you relive the whole potential or potential experience that you're going to have. So the ongoing support is really necessary through this journey. And I had amazing assistance from both my work family and my own family and my friends. LUNGevity came at a really critical time. I had just finished chemo. So when I attended the Lung Summit, it was really a privilege to be around the power of such survivorship, people like Randy and 60 other people that were just amazing. And I think that is needed throughout this whole journey. I just happened to have scanned this week, and I can tell you that last week, my sense of turbulence throughout the waiting for the scanning was the same as it was a year ago. So that piece for me never gets any easier. So the support needed is ongoing. So it's something that I think it's going to be throughout this journey. I'm going to need support for the long term.
Yeah, we did actually get a question from someone listening about how you're both doing today living with cancer, if you want to speak a little bit to that.
You want to go ahead, Jose?
Sure. I'm doing extremely well, so I am blessed. I'm really fortunate. I just scanned again this week, and my scan was, no evidence of disease. So I am, very grateful that a year and a half later, I am still, with no evidence of disease or no recurrence. But it's an ongoing, thank you. But it's an ongoing battle. Every time that you get an ache or a pain, whether my back hurts or whether, you're getting recurrent headaches, you always think, well, it's a cancer coming back. So it's great. I will be going from, I think, every 3 months scanning to every 6 months after my next doctor's visit. So that will be a little bit of a change in living quarter to quarter, now living to 6 months to 6 months.
And I've done it a little bit longer, and I just had my 6 months last week as well, or actually the week before. and I still had no evidence of disease, and my oncologist actually used the cure word. And so I certainly can empathize deeply with Jose as far as the anxiety, which we all experience before we go in. It, for me, has diminished over time, and then everyone should know I was inoperable stage 3, which again, you talk to anybody that is familiar with this disease, and that's not positive. So living now for me is quite a bit different than prior to my diagnosis. I live every day. I don't take things for granted. Do I still flub up in missing things? Absolutely. But for the most part, I am a lot more present, and I'm a lot more engaged with the people and the things that matter in my life. It's the disease has a way of opening up your vision or your view of the world in a slightly different way. And so one of the things that I did that helped me a lot, I wrote a book right after I finished my treatment. And that was a very cathartic experience. And I didn't write about having cancer. I just wrote about things that mattered to me and things that I had learned and things that were really important that I could pass along. And again, I would recommend that to anybody, whether they want to get a book published or just write their memoirs. Again, it was very fulfilling, and it helped me a lot in that initial period of time.
You know, Katie, you mentioned that your father had lung cancer. I'm wondering if you maybe want to talk a little bit about the experience of having a family member with lung cancer and supporting that family member.
Right. My dad was diagnosed in 2002. So at that time, there were the same treatment options that there were 30 years ago. We've come a long way in the last 5, 6, 7 years, but it wasn't anything that could have helped my dad in 2002. And at that time, I was a primary caregiver for my dad, and I didn't know anything about cancer or lung cancer. I thought, okay, you find it, you have a biopsy, you get it out, everything's fine. Unfortunately, with lung cancer, it's usually not detected until the latest stages because there are no symptoms until the latest stages when it's moved outside of the lung. So that's why 80–85% of folks diagnosed with lung cancer is in the latest stages. So it was really hard. For me, I found no support locally. I didn't find any support online. And what I'm extremely proud of is the work that LUNGevity has done in the last 10 years, becoming the largest network of support for folks with lung cancer, having programs like our Lifeline Support Buddy program and our online caregiver support resource center, all of those things. When I'm working on those programs and when I'm supporting patients, I do all that with my dad in mind, because I said then and I say every single day, I don't want anybody ever to go through this alone. I don't want them to experience the isolation that we did, or the stigma, or all of the misconceptions that we did in 2002 and 2003. He passed away 11 months and 21 days later, but there are so many folks now who are surviving the disease, like Randy and like Jose, and that's what we're working really hard on every day.
Great, and I guess, you know, we've talked a little bit about this, but all three of your advice for people who are newly diagnosed, you know, where they should look, you know, obviously if they should look at LUNGevity, maybe other resources or groups that you would want to refer people to or think they should reach out to?
This is Katie. I'm going to make this short and sweet. But Caring Bridge is a fantastic resource to let your family and friends know about how your treatment is going. There are meal trains that you can register for to have people sign up to bring you meals while you're going through your treatments. And, you know, blog.com, WordPress, Facebook, all of those pages are really great at sort of journaling what you're going through and to create a site so that folks can support you.
Yeah. And Randy or Jose?
Well, I would say for me, from an advocacy standpoint, LUNGevity gives me everything I need. I participate with my caregivers quite a bit at where I receive my treatment, and I live in Seattle, And so I'm involved with Fred Hutch Cancer Research Center on a regular basis. I'm actually on an advisory board there. So those are the kinds of things that I get involved in. But again, from an organized advocacy group, I really have not looked much further beyond LUNGevity since I've been connected to them, because they satisfy just about everything I'm looking for. I did just come across NCCN.org, which is Katie, what is that, National Cancer something network. I can't remember exactly, but they had a roadmap book on there that I just came across that I found extremely helpful. And they have not just lung cancer, but just about every cancer that there is. And so anybody that is newly diagnosed, I would say that that's a very good resource as well for information. But it's nccn.org. And I haven't spoken to anybody there personally, but I was amazed at how deep their website, I thought was much better than a lot of the other cancer websites that I've gone to.
And Jose?
You know, much like Randy, actually, I'm fortunate to be involved with the Ohio State University James Cancer Hospital, so I also sit on an advisory board there, and of course work with LUNGevity. But so that's as far as advocacy. But as far as support, I also get support from both LUNGevity and my local support group. I cannot stress enough how much it is, how important it is to put yourself out there, because like Katie stated brilliantly before, we get much more than we give. So the work of advocacy is good for your health, I believe, and also seeking support from people going through the same experience that you are. There's power in that. And if we can learn a little bit from breast cancer, for example, they have an amazing sense of community. And that's what LUNGevity through the summit gave me. It was a real sense of community that I think is key in survivorship. And unfortunately, lung cancer doesn't have that across the board. So building those systems or helping build those systems that can provide support for people living with cancer, I think it's key for survival.
And I just have one more thing to add as well, is collaboration. I think collaboration is extremely important. If you don't have an in-person support group in your area, going to your hospital or your cancer support community and trying to facilitate or build one, advocating for others who have lung cancer as well, and partnering with other organizations. Meals2Heal.com is an organization that helps cancer patients with nutrition and meals. Folks like NeedyMeds, you guys, help with prescription assistance and learning how to navigate that aspect of things. So I think collaboration is a big key in trying to further the survivorship of folks impacted by lung cancer.
Yeah, and we certainly, NeedyMeds, agree to that. Kind of can segue into just a little bit about NeedyMeds and the resources we can offer to those affected by lung cancer. So we are, in case you don't know about us, a national nonprofit organization, and our mission really is to connect people to all the different health care and medication assistance resources that are out there. So we have a lot of different types of information we list on our website, try to connect people to any type of help that we can find for them. So I actually met Katie at a conference in June, and we've been collaborating on some projects since we met, because while we can provide information about, medication assistance and healthcare costs, we really try to help people with all different kinds of healthcare and support and emotional support and things like that. So we do have a lung cancer resource page. You can go to that on our website to find just links to assistance programs for medication someone might be taking who has it, links to groups that actually help people who have lung cancer's diagnosis with the costs of all different costs of health care, maybe travel, housing, all different kinds of things. So that page has all the resources we know about. We run a free drug discount card too for medications you have that might not be covered under insurance, or if you're uninsured. And we also have a special co-branded LUNGevity card. So you can go to our NeedyMeds website to print out a regular card. You can contact Katie to get a special LUNGevity card. They're all going to work the same way. But again, we really believe in collaboration as well, and we think that's really important. We're really excited to be working with LUNGevity in a lot of different ways. So So I think we do have another question, so I'm just going to read that quickly. So Katie, can you see that question there?
I cannot.
Okay, well then I will read it out loud. There's a question about getting involved with advocacy. This person's a 15-year survivor of lung cancer, and she's just sort of trying to find out about how to get involved.
Right, so I would suggest, and of course I'm going to talk about LUNGevity because I work for LUNGevity and I'm LUNGevity's biggest fan, but I would suggest going to lungevity.org, click on the support menu, and then click on LUNGevity. Link Up is our advocacy initiative. What we do is, it's free registration. It's a tiny registration. There's no commitment. And what we do is we provide you with the member packet that gives you information and brochures and information materials on how to help you become an effective advocate. There are talking points. We have webinars like this several times a year. You can spotlight your story, use your voice the way that Randy and the way that Jose do. And let me just preface right now, those guys are not paid. So all of the things they've said about LUNGevity have been from personal experience, and I appreciate that and them so much. But use your story. Tell your story. A 15-year survivor is amazing. I want to see your face. I want to know your story. I want to put you on our website. I want to spotlight you. And that brings so much hope. And, that is a form of advocacy and sharing your story. We also have advocacy opportunities locally. There may be a health fair. There may be a conference. There may be something in your area that's happening, and you can be a representative for LUNGevity. So, again, I suggest going to lungevity.org. Take a look at what we have, register to be a Link Up member, and let me send you those materials and get you started. And congratulations on 15 years.
Yeah, that's great. So I'm just going to put up some contact information, just a few housekeeping things, and we'll have everyone say some closing thoughts. And again, any last questions, please go ahead and type them in. So you can see we have, for more information about LUNGevity, you can contact Katie or go to the website. And then my contact information is there as well. If you want more information about NeedyMeds, more information about our webinars, we have other types of webinars on our website as well, and a lot of information. You can email me if you'd like a copy of the slides. And hopefully within a week or so, we'll have this video available on our YouTube page, and maybe LUNGevity will put it up on their page. But the video will be available as well, and you can contact me again for the slides. So Randy and Jose, do you want to just kind of do some closing thoughts, and Katie as well, and we'll see if any other questions come in?
Yeah, this is Jose. I'll go brief. I just want to tell that 15-year survivor to call LUNGevity or go to the website at LUNGevity. I want to hear from him or her. Along with Randy, they're my biggest hero. I need to hear their story because it gives me great hope. So I was thrilled to hear that. And I just want to thank you for the opportunity to be here today and to talk and encourage your audience that if they are living with lung cancer, to speak out. It is a cathartic experience, and it will be key to your survivorship. So.
Yeah, and I think, not just lung cancer, but, if you're living with any type of disease, there are resources and advocacy groups out there. If you're having trouble finding them, I'm sure Katie could point you to other disease-based groups that you could get in contact with. And I think it's important, to get involved. Randy?
Yes, I would say get involved, especially if you are surviving with the disease or living with the disease. I can't stress that enough. Again, it's been really, really helpful for me. It's a disease that I don't think you want to sweep under the carpet and kind of pretend like it's not there. I mean, I openly talk about it. I share it, and it helps to do that as opposed to keeping it under wraps. So I can't stress that enough. I think that is, as Jose says, very cathartic, and it helps. It's an interesting journey, to say the least. I was really happy to hear about, like Katie says here, the importance of collaboration within the industry. That you guys like to play in the same sandbox is fabulous. I was not familiar with NeedyMeds, but just based on what you just said on your slide deck there and in your presentation, I think is fabulous. Anybody that should not be denied in this country for any kind of drugs that they possibly could benefit from. So it's fabulous that you guys are there to support. And I'd say between the two, if you've got you and LUNGevity rowing the boat in the same direction with the oars in the water at the same time. Be a pretty powerful duo. But so thank you very much.
We're trying. Katie, before you go, we have someone, and Eric from Scotland, who's on the webinar. So he just wanted to mention Cancer Grace, if you want to talk about that and any closing thoughts.
Absolutely. First, I want to say thank you to Jose and to Randy and to Elizabeth for putting putting the webinar together. I think it's so important to talk about lung cancer and to let other people know that there are survivors and there are resources out there. I definitely want to talk about our partnership with GRACE. GRACE is Global Resource for Advancing Cancer Education. We have an Ask the Experts on Longevity, and our experts are from GRACE. It's powered by GRACE, Dr. Jack West. If you go to longevity.org, if you go to or cancergrace.org, you can ask a question, you can browse questions, you can submit your questions, and you can talk to the experts about cancer and ask general questions that way. So we're very proud to offer that resource. We're very proud of our relationship with GRACE. And I just want to say hi, Eric. Eric is a fantastic lung cancer survivor and advocate from Scotland, and he traveled all the way to America last year to make his rounds and visit some of our events, and then he traveled back to America this year, and he joined us at the Longevity Hope Summit in May, and we're so proud to have him. He's a great advocate in Scotland. He's a great advocate in America, and I'm so glad you called in. It must be really late where you are. So in closing, I just want to tell everybody you're not alone if you've been diagnosed with lung cancer. Please visit longevity.org. Please get in touch with us, and please know that we're here for you, and thank you so much for spending your time with us today.
And I want to thank Randy and Jose and Katie for being a part of this webinar. You know, we're really excited at NeedyMeds to be able to expand our education and have webinars like this that can be helpful to those that visit our website and anyone in general. So thank you very much, everyone, for attending this webinar. I hope you all have a great afternoon. And again, you can get in touch with Katie and I if you have any other questions after the webinar ends. So thank you very much.